Good afternoon, everybody. I am Samantha Watson. I'm the CEO of the SAM Fund, and I'm joined by Michelle Landwehr, our COO. Hello. As well as Monica Bryant, who I'll introduce in just a sec, but we are so glad that you guys have chosen to join us for today's webinar about medical bills. And I just wanted to give you a couple quick sort of background and housekeeping things before we turn it over to Monica. So for those of you who may not know anything about the SAM Fund, this webinar series is one of our programs. We call it Moving Forward with Your Financial Health. And we try in these webinars to tackle issues that are common, if not universal, within the young adult cancer community, because we know that young adults face certain issues that people in other age groups just don't face. And so if there's anything presented today that you would like to share with young adults that you know, if you have friends or if you're a caregiver or a provider and want to share this session is being recorded, so you can do so. And you can check out our YouTube channel, which is youtube.com/SamFundTV, and see past webinars that we've recorded as well. We've done ones on health insurance, we've done ones on family building, on budgeting and nutrition, and just a whole range of topics. So feel free to go back and check. They're, as always, totally free for you to download and listen to. And if you have ideas for future topics, shoot us an email, let us know, and we'll do the best that we can to address as many of them as possible. So for those who may not be familiar with the SAM Fund, we are a Boston-based organization. Our programs are national, and we're here to help young adults manage their financial health during and after treatment. And our biggest program is a grants program where we provide direct financial assistance to young adults who are struggling financially after treatment has ended. This year's application actually goes up tomorrow, Thursday, June 22nd. And we'll be up on our website for about a month, so you can check out www.thesamfund.org, and you'll get all the information you need on the application process and any other questions you might have. So keep an eye on that.
That's Wednesday, June 22nd.
Wednesday, so, sorry about that.
No one's confused. It's tomorrow.
It is tomorrow, and today is Tuesday. Okay, got it. Sorry, everybody. In any case, check out our website for more information about that. And feel free to check out our YouTube station for other previous webinars. Two last quick things. There's going to be a survey at the end of this webinar. We rely heavily on your feedback, and so please fill out the survey, be honest, let us know, both what you thought of today's presentation and if you have ideas for future presentations, because we really want to make this webinar series as helpful to you as possible, because otherwise, what's the point? So please take a couple minutes to fill out that survey. And during the presentation today, if you have any questions, please type them into the box on your screen. One of us will either field them during Monica's presentation, or we will read them out loud to Monica, and she can answer them herself. So with that, I am going to introduce Monica. We are so excited to have her back. She's one of our favorite partners in the cancer community, and we keep asking her to do webinars like this because she's just so good at them. So here's her official bio, and then I will turn it over to her. So Monica Fawzi Bryant is a cancer rights attorney, speaker, and author. She's dedicated to improving access to and availability of quality information on the practical, insurance, and financial issues surrounding a cancer diagnosis. Ms. Bryant is the co-founder and chief operating officer for Triage Cancer, a national nonprofit organization connecting people to cancer survivorship information through a national speakers bureau, educational events, and online tools. Additionally, Monica is an adjunct law professor at John Marshall School of Law in Chicago, teaching a class on cancer rights. And today's presentation really is going to focus on controlling the cost of cancer, understanding your medical bills, and learning what you can about negotiations. Because there are so many conversations right now about the cost of cancer, and everybody, blames any number of people or parties for how astronomical the costs are during and after treatment, but there are very few resources out there that help you figure out how to manage those costs. And so that's our goal for today. We hope you enjoy listening to Monica as much as we do. We learn from her every single time she's here. And Monica, we're really grateful to you for presenting today's webinar. So I will turn it over to you with our thanks.
Thank you so much. If only every introduction I got was that flattering and fun. So just bear with me one second as I figured out the tech piece here. Okay, so today we're going to take a pretty deep dive into medical bills, so understanding them and hopefully giving you some tips on how to deal with them. And because this can be an incredibly overwhelming and oftentimes depressing topic, I like to start with a little bit of levity. And so here we have a man talking to his insurance company saying, there's an error in my bill. You accidentally sent it to somebody who has no money. And I think that a lot of us can feel like this after going through a serious medical condition like cancer. So before I move on, I do just want to make sure that we are all on the same page with respect to some terminology. And because understanding how your policy works is really the very first step in dealing with medical bills at all. When we talk about a premium, we're talking about the amount that you're going to pay monthly just to have health insurance. And you're going to pay this whether you go to the doctor or not. And then there are some certain costs that you're going to incur when you actually use your health insurance. The first is your deductible. And this is the amount that you're going to have to pay before your health insurance company will cover the costs for your medical care. The amount that sorry, give us 1 second here. The amount that your deductible is really going to depend on the policy itself. So it could be a situation where you have a $0 deductible, or it could be a situation where you have a $5,000 deductible. That just is going to depend. And again, forgive me as I figure out this tech piece here. Now, your co-insurance, otherwise known as your cost share, is the amount that you're responsible for paying after the insurance company pays their portion. So if you have a plan that has a co-insurance, that means that your health insurance company is going to pay 80% of the cost of your care, and you're going to pay 20% of the cost. A copayment is the amount that you're going to have to pay when you get care. So for example, many policies have something like a $25 copayment when you go and see the doctor, or maybe a $10 copayment when you pick up a prescription drug. Again, it's going to be very specific to the policy itself. And then when we talk about your out-of-pocket maximum, we're talking about your deductible plus any co-insurance you may have paid, plus any co-payments you've made. So it's everything that you're paying out of pocket except your monthly premiums. Now, most insurance plans have a network of providers, and these are going to be doctors and hospitals, pharmacies that have contracted specifically with the health insurance company. And if you end up going to a healthcare provider within your insurance company's network, the provider themselves has agreed to a certain payment rate for treating you. So regardless of what the provider bills, it's that negotiated payment rate that matters to your final cost. And we'll come back to this a little bit when we talk about explanation of benefits. Now, the allowed amount is the amount that an insurance company is going to pay to reimburse a healthcare service or procedure. And then typically you're going to be responsible for the balance if there is any. Now, every plan that covers prescription drugs is going to have a list of drugs that it covers and an amount that it will cover those drugs for. And this is called the formulary. And understanding your plan's formulary will help you save money on your prescription drugs. With some formularies, you pay the same amount for each drug you get. With other formularies, there are specific tiers that you're going to have to pay. So there could be 2 or more tiers. And the higher the level, the more the drug is going to cost you. Generally speaking, generic drugs cost less than brand name drugs. Some brand name drugs may cost more than others. And some drugs are not going to be on the formulary at all. So again, really, really important to understand what a formulary is and what is included in your particular formulary. Now, one of the best ways to deal with medical bills is to avoid them to the extent possible. And the way that you can do that is by making sure that you have adequate health insurance for you. And if any of you have ever heard me speak before, you know that I cannot resist an opportunity to talk about the Patient Protection and Affordable Care Act, or the ACA, because it really just is so important to individuals that are coping with cancer. Too often I hear from young adults that, you know, they bought the cheapest insurance they could because they were trying to figure out how to make ends meet, and this was one thing that they could do. But what they didn't necessarily realize is that although the monthly premiums were the cheapest, the plan itself wasn't adequate and ended up costing them thousands of dollars. So the ACA has made it easier to purchase adequate insurance, and I won't spend a ton of time going into the ACA, but I will say that on triagecancer.org we have a specific resources page dedicated to health insurance and healthcare reform, and I know SAMFund has a video on health insurance archived as well as us. So if you really are sort of not understanding what's in the Affordable Care Act, I urge you to spend an hour or two watching these webinars because it really can make a huge difference. I do quickly want to talk about why math matters when looking at health insurance plans. And this is actually pertinent information whether you get your health insurance through an employer, or you get your health insurance directly from an insurance company, or you buy a policy through the plan's marketplaces. If you buy through the Affordable Care Act marketplaces, there are 4 main levels of plans that you can buy. And they differ based on how much the plan will cover and how much you are responsible for. In other words, the cost share. So a bronze plan is one that will cover 60%, and you're responsible for 40% of the healthcare costs. And it goes up from there by 10. So the silver plan is going to be 70-30, the gold is 80-20, and then the platinum plan covers 90%, and you're responsible for 10% once you hit your deductible. Generally speaking, the bronze plans are going to have the lowest monthly premiums. They might appear to be the most affordable, but they usually have the highest out-of-pocket costs and the or highest out-of-pocket maximums, and they usually have a smaller network of doctors and hospitals. Whereas the platinum plans are going to be the most expensive monthly, but generally have a lower deductible and a lower out-of-pocket max and the largest network. So if you are faced with an opportunity where you get to choose between a couple of different plans, here's what I'd like you to consider. I want you to think about the math. So on the screen right now, I have examples from a marketplace, and I have a bronze example, a gold example, and a platinum example. Now, most people who would just look at this on first glance would think that the bronze plan would be the cheapest at only $105 a month. But you have to realize that you have to pay the entire deductible out of pocket before the plan starts picking up costs. And if you look at the out-of-pocket maximum, you see that it's quite substantial at $5,250. Now, if you are someone that rarely uses the healthcare system, then maybe a bronze plan is a good idea for you. But my guess is that you wouldn't be on this call if you didn't see the doctor with some sort of frequency. And chances are most of you are going to hit that out-of-pocket max. So the way to figure out what the plan is actually going to cost you is by multiplying the monthly premium by 12 to figure out how much it's going to cost for the year, and then adding the out-of-pocket maximum. So I've done the math here for you, and what I hope you can see from this is over the entire year, the platinum plan here is in fact the most cost-effective for someone who's using the healthcare system. And it's not just about being the cheapest, but you're also likely going to have access to a much wider network of doctors and hospitals. And again, even though this is an example from the marketplace, if you have a choice of plans with your provider, with your employer, a similar analysis would be relevant and could be really, really helpful to you. So I would also say that once you've narrowed down your choices, it's really important for you to look at both the provider directory and the list of covered drugs, or that formulary I was talking about earlier. So if you've done the math and figured out, okay, this Platinum plan is in fact the most cost-effective plan for me, you do need to take it one step further and make sure that any healthcare providers you're currently using or plan to use are in fact in-network. Because the reality is the out-of-pocket maximums generally only apply to in-network providers. So if you're seeing someone out of network, not only are you going to be charged more for that, but it's probably not going to be applied to your out-of-pocket maximum. So getting health insurance is only half the battle. The other half is about making the most of the policy you have. So some quick tips here is, again, to use in-network providers whenever possible. And I fully recognize that sometimes this is really tricky because out-of-network providers can sometimes creep in to your care without you even knowing. So for example, if you've had surgery, the surgeon and the hospital might all be in network. Maybe the anesthesiologist is out of network. And it's not always possible to avoid, but you can at least try and request that all the providers you're going to be using for a particular treatment or service be in network. And if the reality is that there isn't an in-network anesthesiologist, sometimes you can negotiate ahead of time to be charged at an in-network rate. It's also really important to be vigilant about reviewing your bills, and we're going to talk more about that in a couple of minutes. Just remember that it's people who are doing the coding at your doctor's office, and people make mistakes. So you have to check over your bills and make sure that you actually received all of the services you get billed for. And then the other thing that we're seeing is sometimes preventative services are being billed incorrectly. And thanks to the Affordable Care Act, as long as you don't have a grandfathered plan, you shouldn't be getting billed for covered preventative services. And a grandfathered plan is, at this point in time, really only large group employer policies that have been around since 2010 and haven't made substantial changes. And so if you're not sure if you have a grandfather plan, I definitely suggest that you ask the person at your employer's office, whoever deals with benefits. And then lastly, a great way to maximize your policy is to leverage this concept of out-of-pocket maximums. And so this is an example of how it all works. Let's say you have a plan with a $2,000 deductible, and it's an 80-20 plan with an out-of-pocket maximum of $4,000. You have a $102,000 hospital bill. So what do you actually pay? Well, first you have to meet that $2,000 deductible, which leaves you with $100,000 left. Your coinsurance amount is 20%, so that might mean that you have to pay $20,000. But thankfully, you have a policy with an out-of-pocket maximum of $4,000. So you're only going to be responsible for paying a max of $4,000. Of course, this is assuming that all of your care was in network. So what I mean by leveraging your out-of-pocket max is that if you're in a situation where you've hit your maximum, maybe you want to think about getting any other medical care you might need that year. Do you need other checkups or a surgery? Have you also hit your family out-of-pocket max? If so, then I would suggest maybe everyone in the family getting whatever care they need as opposed to waiting until next year when you have to hit that deductible and out-of-pocket max again. And if you time it right, you might be able to save yourself a significant amount of money. Now, I'm certainly not advocating getting services you don't need or delaying care just for this reason. I just simply want everyone to be aware of how this works so that they can really use it to their advantage. Now, the reality is even having adequate health insurance isn't going to completely eliminate medical bills, if only that were the case. And survivors are often left feeling like this guy who's chatting with his friend saying, my doctor told me to avoid any unnecessary stress, so I just didn't open his bill. And while this is certainly an interesting coping strategy, it's not one that I necessarily recommend. But short of avoiding the bills altogether, there are some things that you can do to reduce their burden. And it starts actually even before you receive care. And I recognize that many of you are post-active cancer treatment, But I did want to share these tips with you anyway because it might be relevant for you for follow-up care you might get or just future care in general. So you can, in fact, negotiate your hospital bill. Most hospitals have a billing department and even patient navigators that are trained to help you with this process. When it comes to getting lab work, not all labs charge the same amount. So get a list of tests that are going to be performed and shop around. I've given you some links here. Healthcare Blue Book is a site where you can put in your zip code, and it will give you the fair market value of the tests in your area. Community health centers may offer some care at a lower cost than perhaps a large cancer institute. If you can, I would see if you could group your appointments together. Not only does that make life a little bit easier in terms of scheduling and work and transportation and all of those logistics reasons, but it also could help because now you're only going to pay one copay for your office visit. Of course, this might not always be possible, but it's one of those things where you never know until you ask. There may also be times when you can take a generic drug instead of a name brand drug, which might be less expensive. Or maybe there's even a less expensive course of treatment. But if you've never discussed finances with your healthcare team, they might just be giving you the option that they're used to. So again, I'm certainly not saying that you should have your treatment decisions be purely financially based, but I do just want to make sure that people are having these conversations with their healthcare teams and that to know that there's nothing to be ashamed of about talking about finances with your medical team. Because the reality is you're the one that's going to have to deal with the aftermath if your treatment isn't covered by insurance, and you're going to be the one that has to deal with all of those medical bills. Once you've received care, you're probably going to get a ton of correspondence. So just from your insurance company, you could get 3 different pieces of mail. One saying that they've received a claim, one saying that they're processing your claim, and then you're always going to get an explanation of benefits. You can usually tell it's an EOB or an explanation of benefits because it'll say somewhere in large letters, this is not a bill. But this document is really, really important because it's going to give you an idea of how much you're going to have to pay out of pocket. Now, these EOBs can be a little bit challenging to decipher, and so we've given you some websites that might be able to help you. And if you have questions about billing codes or the cost of things, you should definitely call your insurance company and or your provider because, again, people are the ones that are doing these billing statements, and they make mistakes. So this is just an illustration of the types of information that you might find on an explanation of benefit. Every insurance company presents this information in a slightly different way, but generally they should all have kind of this basic amount of information. So again, the first telltale sign that it's an EOB is that somewhere it will include the words, this is not a bill. You'll also be able to see the information about the policyholder and who the claim is for. So in this example, Sally is the policyholder, and the bill is actually for services that her daughter received. There should also somewhere be some kind of summary claim itself. So here the summary is giving us the total billed amount, the total benefits approved, and the total amount that Sally might owe the provider. Now in this chart, you'll see there's a date of service, a description of the service, possibly an unidentifiable code to normal people, the amount billed, the amount not covered. Now, this amount not covered is typically about the difference between what the provider has billed and what the insurance company has contracted with them to pay for certain services. So here you can say, you see, if you do the math, that the insurance company has actually agreed to only pay $330 for routine lab services. So $90 is not going to be covered. The next column here shows that Sally has a 10% co-insurance, which means that 10% of what she, or 10% of the total amount is going to be what she owes, which is the $33. Again, this is a very, very simplistic overview, but it was next to impossible to find a clear image of an explanation of benefits that I could fit on a slide for you. Now, the last kind of nugget of information that you're going to find on explanation of benefits is that somewhere it should indicate how much you've paid towards your deductible for the year and how much you've paid that has been applied to your out-of-pocket maximum, both for yourself and for your family, if you have a family policy. So here you can see Sally's met her $350 deductible for the year. She's already paid that out of pocket. She's paid $421 towards her $1,500 out-of-pocket max. And then between Sally and her daughter and maybe her husband, they've all paid $803 towards their family's $3,000 out-of-pocket max. As we've talked about before, keeping an eye on this out-of-pocket maximum can be really, really helpful, and you can definitely use it to your benefits. Now, the last piece of information you're probably going to get in the mail is going to be from your provider directly. This could be the hospital where you got care, the doctor's office, from a lab company, and the amount here is the amount that you are probably going to be responsible for. But don't always take it at face value. You've got to really compare it with those EOBs. Also recognize that the mail doesn't always arrive in the order that I've laid out, which is why it's critical to keep track of paperwork. So let's think about Laura, for example. She received a bill for her son's last checkup for the full amount of the visit, but she knew that her insurance should cover at least a portion of it. She hadn't received the EOB yet, so she didn't know exactly how much insurance was going to cover, but knew that they should cover something. So although the bill from her provider's office had a due date that was close to passing, Laura didn't want to overpay the provider and hope to eventually get something back. So she called the doctor's office and explained. They pushed back the due date and asked her to give them a call back when she got the EOB. Once she got the EOB, it showed that they were going to cover, the health insurance company was going to cover a portion. And when she called her doctor, they said that they would rebill her when they got the check from the insurance company. She later received an updated bill from her provider and paid that amount. So for sure, I'm suggesting it's a few extra steps that you have to keep track of here, but it could save you quite a bit of money. And frankly, probably some anxiety as well. I've said it a few times, I'm going to say it again. We definitely recommend that you review bills for accuracy. Don't be afraid to ask your provider to clarify the codes. So if you get an EOB with all these CPT codes and you don't know what they mean, you can go to this website from the National Institute of Health that I've provided, or you can just call your doctor's office and ask for the billing manager and just say, I'm just trying to go through my EOB and I don't understand what this code is. Can you let me know what the service was for? Most of them are going to be more than happy to help you through this process. If you have extensive medical bills, whether they're outstanding or whether you've already paid them, you may want to consider talking with a professional bill reviewer or a medical claims organization. Each review service is set up a little bit differently, so some will charge you an initial fee, some will just charge you a percentage of whatever they're able to cover. And I've given you some examples here, but just keep in mind I'm not necessarily endorsing any of these services. I just wanted to give you some examples. So for example, Chapman Consulting says pay us $350 up front, and then we'll take 25% of whatever we're able to recover for you. Co-Patient Inc. says we're just going to take 35% of whatever we're going to recover for you. So there's lots of them out there. I just definitely recommend that you understand how they're going to charge you before you sign up with them. And while a professional bill reviewer might be really helpful, I still think that you need to create a system, an organizational system for yourself. There are some out there that exist that you can use as a template. So Cancer 101 has one, Livestrong has a survivorship notebook, but it really doesn't matter what you use. I know people who use a 3-ring notebook with dividers. I know people who scan everything and save it on their Google Drives so they can access it from wherever they are, including their cell phones or their iPads. I know people who use file folders. The only thing I don't recommend is sort of what I call the shoebox method, which is everything just gets shoved into a shoebox, because really it's going to be challenging for you to find anything in the future if that's the case. This is an area where I actually think it might be a really good place to enlist the help of friends and family. So I'm sure most of you at some point heard something to the effect of, let me know if there's anything I can do to help. And a lot of times such an open-ended statement can be hard to wrap your head around. What do I really need help with? Well, maybe one thing that they could do is just go through the stack of mail, sort out the junk mail, open communications related to healthcare, throw away the envelopes and all the extra stuff that comes in those envelopes, and then spend some time matching the EOB with the corresponding bill and stapling it together. That way all you have to do is go through the organized pile and figure out if everything is correct and then what you actually have to pay. So I'm just going to take a second to detour from bills because we're actually making great time. I want to highlight some services that are out there that might be helpful in general to organizing your medical information. These services, most of which cost just a little bit, but these services are all electronic ways to organize your medical information. And I'm not going to go into a huge amount of depth, but I do want to say that we have a webinar archived on our website that was presented by Sarah Skillen of Skillset Organizing, and she does a great job of kind of going through how we can avoid drowning in documents, because the paperwork is just one more thing that you have to deal with on top of all of the other things that come with a cancer diagnosis. And these services can really start to alleviate some of that burden and some of that stress. So when I talk about medical information, it's certainly things like information about doctor's visits and tests and scans and results and all of that. But you also have to keep track of the medical bills that we've talked about, drugs given, prescriptions ordered, claims filed. You also want to keep track of pre-authorizations if you've had to get any of those. Definitely you want to keep track of any correspondence you've had with insurance companies. And then anything that's non-reimbursed. So meals, lodging, any travel expenses you might have had around care, because some of those things might end up being deductible on your taxes. If you have any of these expenses, please make sure to mention them to your tax preparer and keep records of the expenses for a minimum of 3 years, just in the event that you're audited by the IRS. You want to be on the safe side. Now, if you are in a situation where you owe money to healthcare providers, try talking with them. It sounds so simple, but it can have a huge impact. Definitely the suggestion is to do this before your unpaid bills get turned over to collection agencies, because once they get turned over to collection agencies, now you're potentially dealing with damage to your credit score. If you can't make a payment, be very concrete in what you're asking for. So ask for more time. Ask to see if maybe they're willing to negotiate a payment plan or accept a lower sum payment. This concept also applies to other creditors like landlords or student loan companies or credit card companies. And you'd be really surprised at how flexible creditors can be, especially if they know that you've faced a significant hardship like cancer. And the motto here is really, it can't hurt to try. One word of warning, please be careful if you're considering paying medical bills by credit card. Most credit cards have a very high interest rate, and you will likely end up spending way more than is necessary. It's also not really recommended to take out a loan on your home, otherwise known as a second mortgage or a home equity line of credit to pay your medical bills, because you're then turning what's called unsecured debt into secured debt. And now, if you aren't able to make the payments, you risk losing your home. So if you have received treatment and the insurance company just denies the claim, you have the right to appeal that denial. Most insurance companies have an internal appeals process, and the details are going to vary based on the company, so it's really important to check with your policy or contact your insurance company for more information about their specific internal appeals process. Now, thanks to the ACA, all states are also required to have what's called an external appeals process, sometimes referred to as independent medical review or IMR. And for details on your specific state's external medical review process, you'd need to contact your state's agency. And Triage Cancer has actually compiled all of that information for you on our state resources page that I provided here. Now, appealing decisions is really important because your chances of getting your treatment covered eventually definitely increase if you appeal. So one study that was done in 2011 showed that somewhere between 39 and 59% of appeals were decided in favor of the patient. So it's really in your best interest to think about appealing if your treatment has been denied, especially if it's a treatment that you are going to be getting on an ongoing basis, because it sets a precedent. If you win your appeal, it sets a precedent moving forward for having that treatment covered in the future. So this flowchart is trying to illustrate how an appeal can work. This is kind of a typical appeal, so I recognize that not all of them are going to be as straightforward as this, but this will give you an idea of how it all works. So if you start at the top here, you've received treatment. The next step is that you or your doctor are going to file a claim with your insurance company to get reimbursement for at least a portion of the treatment. Two things can happen at that point. The first thing is that the insurance company approves the claim. The other thing is that the insurance company denies the claim. Let's stick with the idea that the insurance company approves the claim. So we're on the left-hand side of this flowchart. The insurance company approves the claim. Then they should send their portion to the doctor or the healthcare provider. And then the doctor should send you a bill for the remaining balance. That's kind of best case scenario. Moving to the right side of the flowchart is really the situation that I want to talk about, which is when your insurance company denies a claim. If an insurance company denies a claim, you have the right to file an internal appeal. Assuming you win the appeal, we flip back over to the left-hand side, insurance company pays their portion, and then doctor's going to send you a note. If you lose the internal appeal, that triggers the right to file an external medical review. If you win that external medical review, the insurance company has to send their portion of the payment to the doctor's office, and then you get billed for the rest. If you lose your external medical review, it ends there, and the doctor will send you a bill for the total amount. So again, 50,000-foot view of it, let's break it down about how you actually can go about filing an appeal. The very first step for this is you're going to have to start off by contacting the insurance company if you don't have all of these pieces of information. Some companies are really great. They're going to send you this all automatically if they deny a claim. Others are going to make you work for it a little bit. So the things that you're going to need to get from an insurance company is a detailed description of why the claim was denied. There are a couple of main reasons that something can be denied. Procedural things like incomplete insurance information or lack of pre-certification or prior authorization, billing errors or coding errors, late filings. But then where we see a lot of people need help within the cancer community is they get denied because it's being claimed that there's insufficient medical necessity to cover the claim. So again, really important to know why something was denied. The second piece of information you need is a copy of your evidence of coverage. So this is going to be the plan details so that you know what your policy covers and doesn't cover. And then finally, you want to get a description of the insurance company's internal appeals process because you want to make sure that you follow all of the rules, and some of them have a lot of rules. As you're having these conversations with insurance companies, it's so important to keep track of everything. Dates, names, summaries, all of these things are potentially important. Don't rely on your memory, as this can be a drawn-out process, and you've already got a lot going on. When you contact your insurance company, again, you should get that reason for denial, and then knowing that reason is going to help you figure out how to proceed. Again, in the cancer context, the reason we hear denials occur most frequently is that the treatment was off-label or investigational. So let's say that Franny has lung cancer, but her doctor prescribed her medicine that was originally designed to treat prostate cancer. But this treatment has been successful in patients with lung cancer before. So even though her insurance company's formulary includes the lung cancer drug, they end up denying coverage because they claim that it's off-label. So this is the reason why Franny might be able to appeal. So what she should do, or what you all should do if you're in a similar situation, is gather support for your appeal. First step here is talk to your healthcare provider. Get a letter from them indicating the medical reasons for receiving that care. If the healthcare provider has any notes on the medical care, including how you responded to a particular treatment, that should be included. Any results from tests should be included. And then here's another area where I think especially social workers and nurse navigators can be really helpful in the appeals process. Collect any sort of medical literature or studies documenting the effectiveness of a particular drug. So for example, in Franny's case, maybe there was just a study released at ASCO saying that this prostate cancer drug is showing great results in lung cancer patients. If that's the case, submit that with your appeal. PubMed.gov is an open source resource that can be really useful to get some of this current medical literature. Also, if there's any professional journals or magazines out there that are supporting the treatment, include that. And then finally, it can be helpful to include a short personal narrative describing why you needed the requested service. I don't think that this should be an essay. It shouldn't be every single medical thing that you've ever dealt with, but it should be something personal about what you're going through and why perhaps your doctor thought that you should get this particular drug instead of the traditional lung cancer medications. So the timing is pretty important for appeals. There's three main types of appeals. When you're appealing a denial before you get care, when you're appealing a denial after you get care, or an expedited appeal. If you requested a pre-authorization for coverage of services and it was denied, you can submit this appeal. In the denial letter, there should be a specific time period listed for you to submit the appeal, and then you should get a decision from the insurance company within 30 days of sending that in. You should also get a written notice from your insurance company within 7 to 10 days that they've received an appeal from you. And if you don't get that letter, I think it's prudent to contact them to make sure that it actually got there. Now, if the appeal is for care that you've already received, then you should get an answer within 60 days of submitting the appeal. And in some cases, you might be entitled to what we call an expedited appeal or an appeal for urgent care. And in these situations, the insurance company has to give you a response within 72 hours of sending the appeal. You can only request these expedited appeals in certain circumstances. So for example, you're currently receiving or were prescribed treatment, and the healthcare provider is willing to certify that a delay in treatment could seriously jeopardize your life, your overall health, affect your ability to regain maximum function, or subject you to severe and intolerable pain. The third reason is if you are inpatient somewhere and the appeal is to continue to have you continue to be inpatient prior to discharge. So again, just want to make the point here that you can't ask for an expedited appeal if you've already received the treatment. Now, if you end up exhausting your internal appeal opportunities and the insurance company is still denying the claim, if you have private health insurance, you have the right to request an external appeal. Every state has an external appeals process, and there are two basic steps here. The first is that you file a written request for external review within 60 days that the insurance company sends you your final decision. The second step here is that you're going to receive a decision by the external review committee or the independent medical review, no later than 60 days from the date of your filing. Now, this decision is binding, which means that by law, the insurance company has to follow whatever the external medical review decides. There are three reasons that you can ask for an external medical appeal. Any denial that involves medical judgment where your provider is disagreeing with the health insurance plan. That's pretty broad. You can also ask for these external appeals for any denial that involves a determination that the treatment was experimental or investigational. So that goes back to that off-label use that I was talking about. And then also, you can ask for an external appeal if the insurance company has canceled your policy claiming that you gave false or incomplete information when you apply for coverage. Quick note on external appeals, if you have a policy through your employer, your plan may be governed by a federal law called ERISA, and there's slightly different procedures there, but the basic steps that I've outlined still apply. Now, the reality is that even if you do everything right and deal with your medical bills and appeal decisions, there sometimes still isn't enough money in the pot for everything. And that's where you may have to think about looking for financial assistance or alternative income options. There are different types of insurance coverage that you may currently have through your employer or that you've purchased on your own that can provide financial assistance. The first is disability insurance. This is insurance that provides employees with some income while they're unable to work due to a medical condition. There are private disability policies, employer policies, some states have state policies, and then there are 2 federal policies. Based on time, I'm not going to go into a ton of details about disability insurance, except to say if you'd like more information, we have an hour-long webinar that we did in December, and a recording can be found on our website. We're also going to be updating it soon, but the information is still pretty relevant. You may also have to think outside the box a little bit to find some other sources of income. So do you have a supplemental policy through your employer or a private policy that might help with some expenses? Some of these plans can pay for certain benefits. So I think we've all seen the Aflac commercials where it'll pay for health care, it'll pay for housing, etc. And even if you've completed treatment, you may actually be able to get reimbursed for things that you paid for while you were in treatment. think about maybe if you can adjust your tax deductions so you're getting more money up front in each paycheck. I would definitely suggest contacting your mortgage company or your credit card to see if they have a program where you can suspend your payments for a certain amount of time because of a disability. A lot of mortgages and credit card companies have these programs, but they're not going to tell you about them. You really have to be your own advocate and ask. I would also want to know if you had something like a 401k, a retirement policy that you might be able to use as collateral for a loan to deal with some of these costs up front. And then life insurance. So some life insurance policies allow you to borrow money from the policy if you have a disability, and it's paid back at a very low interest rate, and there's usually no penalty for these policies. And again, some of these policies will allow you to waive or will contain a waiver that will allow you to stop paying certain premiums while you're dealing with a disability. And then finally, a viatical settlement might be a good option. So a viatical settlement is where you sell your life insurance policy to a third party, typically for less than that full policy amount. And while your beneficiary doesn't end up getting anything in the long run, it could be really helpful if you need cash up front immediately. It might be a situation where you need to look at existing financial assistance programs. Even if the bulk of your cancer treatment's over, there might still be medications you need to help manage side effects or other long-term medical conditions that you experience. There are local, state, and county organizations. Of course, there are cancer-specific organizations. The amazing work that the SAM Fund is doing to help provide young adult survivors with a successful transition into their post-active treatment life. But there are also groups like We Believe Foundation and Hope for Young Adults with Cancer, American Cancer Society, Cancer Care might have services. I definitely think you have to be creative when you're thinking through all of this. So maybe you can get assistance with your utility bills so that the money that you've set aside for your utilities can pay for some of your medical bills. And then don't underestimate the power of love. Your friends, family, neighbors, coworkers can definitely be a source of financial help. And they may just not realize that because your treatment's ended, you still need financial assistance. So you might want to consider setting up an online fundraiser. I've given you a couple examples here. But I just have to give the caveat to think through the issue around disclosure. So if you set up an online fundraiser, that is Googleable, and that is something that will be on the internet forever, likely. And it could come up in the employment context. It could come up in a lot of other contexts long term. And so while I'm not saying don't do it, I just want people to think it through. And then there may also be some other ramifications of getting a lump sum payment. So for example, if you're receiving Medicaid based on your income level and you get this big check from an online fundraiser, that could affect your Medicaid eligibility. So just some things to think through before you jump headfirst into an online fundraiser. There may also be some programs that provide financial assistance with co-pays, healthcare premiums, deductibles, etc. There are also organizations out there like Needy Meds and RX Hope that can help with prescription drugs. And almost every pharmaceutical company has a program to help provide people who are having financial difficulties with their medications. There are, of course, ancillary costs to treatment like transportation and lodging, and there are some programs out there. And on a couple of these slides you've seen, I've given you a link to Triage Cancer's website. We've just uploaded a pretty comprehensive list of financial resources. It's a downloadable PDF that just got listed. So for more details about all of these, I would say check that out. And I know that SAM Fund has resources as well. And then as a cancer survivor, you might be eligible for certain scholarships to pay for higher education. So there's special divisions of ACS, as well as Cancer for College and the National Collegiate Cancer Foundation that all have opportunities. And then there's some assistance for paying student loans, and this is often a really pertinent thing for young adults coping with cancer. The good news is some private student loan companies will allow you to change payment plans or maybe even postpone payments through a loan deferment process. And then federal student loans also has a system, if you qualify as having a permanent and total disability, where they will forgive loans. So just keep in mind that any of this loan forgiveness could be considered income on your federal income taxes. So if you go through one of these programs, make sure that you're talking with a tax professional come tax time so that you're appropriately reporting these things. And then if you're in a position where you're maybe looking for a new job or going back to work, a lot of jobs offer loan repayment plans as part of their benefit packages. So if you're in the position to negotiate your package, which I know isn't always a reality, that could be something to consider. So maybe instead of them contributing to a retirement plan for you, it might be more beneficial for you to get payments towards your student loans, for example. So I've talked for almost an hour, and I've given you a ton of information in that short period of time. And I just want to make sure that you have resources where you can go for more information. We've got 2 quick guides that might be relevant. We've got state contact information, so you don't have to go searching on the vast internet for the information. We've got links to amazing partner publications, so please don't reinvent the wheel. And then really quickly, I just want to say we have 3 in-person events coming up where we're going to be spending the entire day talking about health insurance, employment, and finances. Totally free to attend. You just have to register at this link. And if there are any nurses or social workers on the call, we'll be offering free CEUs. We'd love to see you in Nashville, Philly, or Salt Lake this year. And then I'm totally open to taking questions. And as I do, I'm just going to leave up our contact information. We'd love to connect with you over social media, or if there is a question I'm unable to get to in the next couple of minutes, feel free to shoot me an email. So with that, I'm going to turn it back over to Sam.
Thanks, Monica. I swear, every time I hear you talk about this stuff, I pick out some new pieces of information. And so I hope everyone on this webinar and everyone who's listening to the recording afterwards found it as helpful and as informative as I did. You are a fantastic presenter, and you break down some very, very complicated, overwhelming stuff into manageable pieces. So we really, really appreciate it. And I know we're out of time, but if I could recap really quickly some of your key messages, I just want to echo them because I think they're so important, because part of managing this financial challenge is feeling empowered to do so. There's the information and there's the steps you need to take, but really first people need to feel like they have a right to advocate for themselves and that they have, the skills and the ability to communicate effectively. And I think you just provided both of those things so clearly and so strongly that I just, I wish I could see people's faces while you were talking. I imagine when you do the in-person stuff, you see a lot of relief because I know on behalf of our young adult community and the stories that we hear every single day, you address so many of the questions and so many of the fears that people have. And so I think, the sort of key messages that I heard in today's presentation were to communicate and to communicate with your providers, your insurance, with the people around you. To stay organized, open up your mail, don't throw it in a shoebox, stay on top of things, and most importantly, to advocate for yourself. I think everybody who is participating in this webinar has taken that first step towards thinking of themselves as a self-advocate, and you've taken it the next step and given them the tools to be able to do that well. So thank you so much for reinforcing all of this and for all of this helpful information. It was fantastic. So for those of you who are still on the webinar, you'll see there's there are 2 links on your site. One is the samfund.org/get-help/webinars. Really, if you go to our homepage at samfund.org, you'll see the link that says Get Help, and it'll take you to the webinar page, or you can go directly to our YouTube channel, which is SamFund TV, to watch this presentation again. We did get a question during your presentation about whether these slides would be available because there was so much information given, and she wanted to go back to better understand the appeals process. So check out either of those links. It'll take you to the same place. You'll also get a follow-up survey in just a couple minutes.
It'll actually pop up right after the webinar finishes, but if you don't have a chance to take it now, then it will be in a little follow-up email, which you should get later today.
Excellent. Thanks. Sorry about that. So whenever you have a minute and whenever you see it, please take a minute to fill it out. Like I said, we really do rely heavily on your feedback, and we take it into consideration when we choose future topics and craft the presentations around them. So please give us feedback. Let us know how we can best meet your needs. And then feel free to email us anytime at webinars@thesamfund.org. If you have a question that didn't get answered because I saw one just popped up and unfortunately we are out of time, you can send it along to us at webinars@thesamfund.org, and we will put you in touch with Monica and get you an answer as quickly as possible. So thank you guys so much for giving us an hour out of your afternoon. We appreciate you being part of today's webinar. We hope it was helpful, and most of all, thank you, Monica, for doing this and for sharing what you know with the community who really needs it. So have a great rest of the afternoon, everybody.